Jess and Lisa and Laura, they just believed in me and my product right away, and there's nothing better than that. And so we just, every time we got together, it was just a wonderful meeting. I also want to thank Women Standing Together and Maine Women's Fund for giving me this opportunity, and of course all of you for taking time from your busy day to come hear about Jazzy Johnnys and help us solve our next problem. I want to dedicate this presentation to my mother. She really wanted to be here, she couldn't, and I'm probably going to lose her pretty soon. But that's why I have Jess actually doing a video so we can take this to her and she can hear me speak. So this is dedicated to my mom. So I'm going to tell you my story. Back in 2008, I was diagnosed with invasive ductal carcinoma of my left breast. So the cancer had already spread outside of the tumor. I had breast conservation surgery, then I went into 40 radiation treatments. And when you go into radiation treatment, you go in, you put on a hospital Johnny, and you go out into the waiting room. There's probably 10 or 15 people there. And as I'm sitting there, I'm realizing that there's this culture that happens in a cancer waiting room. And you get to know each other and you start talking. And so one day I came in and I was going through the Johnny box and I found this Johnny that was different than all the rest. So I pulled it out and it had a Haitian hospital stamped on the back of it and no ties in the back, and it was huge. But I walked out into the waiting room and I had it rolled up in my back, and everybody's like, "Hey Patricia, where did you get that Johnny?" And I said, "Well, it's at the bottom of the Johnny box." So we were talking about how awful it is and how hard it is to go through cancer treatment and wear something that is so humiliating. So when I went to get my radiation treatment, I was talking to the radiation technicians and I said, "Hasn't somebody else come up with something better than this? This is just so humiliating." And they said, "Well, why don't you?" And I said, "Well, can I?" And they said, "Yes." I said, "We'll help." So anyway, I jumped off, well, actually before that, I was trying to think of a name while I was sitting there getting my treatment, and I had just seen Breakfast at Tiffany's with Audrey Hepburn. And one of Audrey Hepburn's favorite words in that movie was jazzy. So I thought, oh, Jazzy Johnnys, that's the name. So I jumped off the table and went to go see if there was any competition, and so that's how it all started. To date, Jazzy Johnnys has received 2 seed grants from the state of Maine's Maine Technology Institute. They're both for introducing a plant fiber fabric to the healthcare industry, for creating an innovative way to distribute that product through the health supply chain, and for benefiting the environment. We had a few production problems in and out of the state, and we finally ended up with a small production company in Scarborough called Golden Thread. So our products are actually made in Maine. Our mission, Jazzy Johnnys, is dedicated to providing healthcare facilities with an eco-friendly alternative to the standard hospital gown. Through our BYOJ program, healthcare facilities can reduce their bottom line, reduce their impact on the environment, and provide their patients with a dignified and comfortable garment that enhances the patient experience. There is a movement that's happening across this country in healthcare, and it's a sustainable green movement. And it's getting a lot of press now. There's organizations like Practice Green Health, Healthcare Without Harm, Green Hospital Association, and Green Clinic, just to name a few of them. These organizations are committing to adopting more sustainable practices and purchasing more eco-friendly products. And this is where Jazzy Johnnys fits in right here. Actually, I want to read to you the goal for Practice Green Health, of which hospitals like the Cleveland Clinic and the University of Chicago Hospital are part of. Sustainable healthcare that's good for the environment, good for patients and staff, and good for the bottom line means action plans to eliminate mercury, reduce and recycle solid waste, reduce regulated and chemical waste, reduce energy and water consumption, create healing environments, and establish green purchasing policies. So this is where Jazzy Johnnys fits in the healthcare industry. We can provide a way for the hospitals to save money, but also enhance their patient experience. Okay, let me talk about our products. First of all, our products are made from tencel, which is actually wood cellulose, and it's a woven tencel. And it has a lot of really wonderful medical properties. It's antibacterial, it's temperature regulating, it's skin sensitive, and it absorbs moisture. So bacteria forms on the skin with the moisture, and the moisture is actually lifted into the layers of the fiber, and that's what helps reduce the bacteria. We have obviously a variety of different options for people, which is not always the case with a hospital gown, and ours don't open in the back. But we have a couple of tops, 3 pairs of pants, a robe, 2 different Johnnies, and then my mother actually helped me create some of these. This is a wearable organizer that is for people who have limited movement so they can keep their call button and their glasses and their cell phone and everything within reach for them. And I also have one for those that were bedrail. So Jazzy Johnnys offers these different products, but because Tencel is only produced over in Asia, it's very expensive, so it adds to the cost of the garment. In order for us to be able to offer it to the healthcare industry, we had to think of a way to make it affordable for them. So that's where the BYOJ program comes in. That's called Bring Your Own Johnny. Now, the Bring Your Own Johnny program does not replace regular hospital gowns. Those will always need to be there for acute care. But what it does is in cancer, long-term care, repeated care use, post-op, it provides a patient with a garment, a brand new garment that nobody else has ever worn. So at the onset of their treatment, they get a Jazzy Johnny and they get a bag. And they're responsible then for maintaining that garment. And so they wash it and they bring it back and forth to their treatments. And that's how the program works. And what we did was, there was a hospital study done on hospital gowns back in 2009, and it was funded by the Robert Wood Johnson Foundation. And what we found out was that the typical cost of a hospital gown costs between $3 and $9. It costs $1.45 every time you wash that garment, and the useful life of a Johnny is between 40 and 50 washings. So what it ends up being is the total cost of a useful life of a Johnny is between $600 and $800. So even if a healthcare facility bought 2 of my garments at $64 each, they would be saving over $600 per patient. And again, this works in repeated care use, so that if somebody is going, like I had my 40 radiation treatments, and I wore 40 different Johnnies. So this is the big question that we're going to be posing to you in terms of helping us get to the decision makers of the hospital, because they're definitely going to have to change the way that they do things right now. You know, they're going to have to commit to a whole department, like let's say the radiation department. All the radiation patients will get a Jazzy Johnnys. They'll have to have a backup hospital gown in case somebody forgets. But that's the way they're going to be able to have to track this program. Of the hospitals that I've been to see in Maine, practically all of them confirmed that they spent over $20,000 a month replacing hospital gowns and hospital linens. And not one of them knew exactly how much it cost them for their hospital Johnnies, the life of a hospital Johnny. They knew what it cost initially to buy it, but they've never tracked it and followed it through. And that's where this study gave me that sort of missing piece of information. And to date, we've done 2 pilot programs. Our first pilot program was through the radiation and medical oncology units at the Cancer Center in Augusta, the Harold Alpine Cancer Center. And then the second one is actually going on right now, and it's through New England Rehab in Portland. And we had a great fashion show a couple weeks ago, and went into all different patient rooms, and people signed up to volunteer to be part of our pilot program. So some of the things that we've gotten back on the healthcare surveys I'm going to share with you so that it can help give you a little information on how people that are actually using our garments are responding to them. Of the healthcare providers that we surveyed, all indicated they felt it was important for their healthcare facility to offer patients an alternative to the hospital gown. They also indicated that Jazzy Johnnys garments helped facilitate treatment and did not interfere with the ease of treatment. And that's an important thing, because in any design that you have in the hospital, they want to have accessibility to that patient. So that was not a problem. Of the healthcare providers surveyed, all indicated from their observation that the patient was comfortable wearing the gown, and they also indicated that it mattered to them that the gown was eco-friendly, so they did care. Okay, now I'm going to get to the hard part of it. This is my favorite part. You can steer me off this. Of the cancer patients at the Alpine Center, they all indicated that they did not mind being responsible for their garment. They loved having a garment that nobody else ever wore. So that was a really, really important piece for them. Of the patients surveyed, they all indicated they would feel better about a healthcare facility and recommend a healthcare facility if they offered an alternative to the hospital gown. Of the patients surveyed,